Firstly, permit me to reflect on the OECS Economic Union, because it was less than 1 month ago, on June the 18th to be exact, that the Eastern Caribbean Economic Union became a reality. This accomplishment was the direct outgrowth of OECS heads and staff's determination to grapple with the most complex of issues, that is, for the betterment of our Caribbean region, specifically, of course, the sub-region, the OECS. And it builds on a substantial track record of OECS integration in such areas as civil aviation, telecommunications, pharmaceutical procurement, and so on. Indeed, the effectiveness of the OECS integration initiatives is made manifest in the fact that as CARICOM ponders the way forward, it is the OECS and the EU, the European Union that is, that will be used as models of integration efforts that work. I should also add that the OAS model would also be considered. Still within the regional context, I want to mention something about the health status in the Caribbean region, because as the CARICOM head with responsibility for health and human development, I have long promoted the establishment of a Caribbean Public Health Agency referred to as CARPHA. This is an absolute priority and is urgently needed if the region is to adequately meet the health needs of our people. CARPHA will do the following. 1, it will represent a single voice for Caribbean public health. 2, it will facilitate our region's health-related collaboration with the international community. And 3, it will permit our implementation of global health guidelines. CARPHA was approved by CARICOM heads at our intersessional meeting in March of this year. And at a subsequent meeting in Washington, D.C. a few weeks ago, the support of the Caribbean Development Bank, the Caribbean Tourism Organization, the Inter-American Development Bank, the World Bank, Sweden, France, the United Kingdom, Canada, and the United States of America was also aggressively sought and was obtained. CARICOM member states are already spending on 5 separate facilities. CARPHA then would facilitate the merger into one more efficient and much more effective agency to serve the needs of the people of the Caribbean region. It is envisioned that this important facility would be located in Trinidad and Tobago as a logical supplement to the Caribbean Epidemiology Center, that is CAREC, as we know it as, that is already situated there in Trinidad. The support of the previous government of Trinidad and Tobago for this center to be located there had been secured a long time ago. I therefore look forward to moving with the new Prime Minister of Trinidad and Tobago, the Honorable Basseterre, as well as on this very important initiative that is so urgently needed by the people of the Caribbean region. Also on the issue of health, let me also mention that in light of the toll that chronic diseases is taking in our region, I have also been in talks with the United Nations Secretary General Ban Ki-moon, urging the establishment of a United Nations mechanism that would monitor and evaluate non-communicable diseases, and in light of the profound concern of CARICOM heads regarding the impact of guns and illegal weapons from the rest of the world on our region, and in light of the impact of these illegal weapons on life and death in our region, I have already assured the United Nations Secretary General of my own intention to play a very active role in the United United Nations Arms Trade meeting that is now scheduled for 2012 in New York. Permit me to say a few words on the Prime Ministerial Expert Group on Governance that came out of the CARICOM meeting in Jamaica recently. Because CARICOM established a Prime Ministerial Expert Group on Governance, on which I am honored to serve. Our mandate in this particular group is to map the region's way forward, both in terms of focus and structure. We will be presenting recommendations to CARICOM heads in September of this year, and we will make concrete proposals to the CARICOM intersessional meeting that is expected to be held in February of next year in Grenada.